Hello guys, so we are back with another Saturday live. Hashtag Superphysios is live. So today in this live, we're gonna discuss all about internship, like when we do, what we learn, and yeah, what exactly is internship in physiotherapy. So now let's add the superphysios for today's live. So for today, it's Ashish sir and Hina ma'am and Mehta ma'am are our super physios. So let's add them and know many more things about internship in physiotherapy from them. And also, if anybody has any question, do write down in the comment section or the question section box. So let's add. Hina and Mehta ma'am, if you are in the live, please send me the request.
Hello.
So here is this. Hello, sir. How are you? Hello, sir. Can you hear me?
Hello, how are you? Yes, I can hear you.
I'm good. So let me reset the today's live topic. So today we're gonna discuss all about internship in physiotherapy.
Yes.
So by the time Hina ma'am and Mehta ma'am join us, so can you tell us about your experience during your internship period?
Okay.
Hello,
Hi,
ma'am.
Hina.
Hi Neha.
How
Hi,
are you,
Ashley.
ma'am?
I'm good. How are you both?
I'm good. I'm good, ma'am.
Actually,
Okay.
end time emergencies came and Mayanta won't be able to join us.
It's
Oh,
okay. We are glad
it's
that at
okay.
least you are here. We will get many more insights from you.
Sure, sure.
Okay, so we were talking about my internship experience in general. So my
Yes.
internship experience is basically divided into two parts. One in Sancheri Hospital, Pune, and another is in Ruby Hall Clinic, Pune. So Sancheti is an orthopedic specialty basically. So ortho exposure is very much over there.
Yes, sir.
Am I audible?
Yes, sir. Yes, sir. You are audible.
Okay, okay. I can't see both of you actually. There's some network
Okay,
issue, I guess.
maybe it's a network issue from your side because I can see ma'am and you too.
Yeah,
Yes, yes.
you both.
Yes,
Okay,
yes.
okay.
Even we can hear you. You can continue, sir.
Yes, okay. So first of all, we need to change this perception कि internship में बहुत ज़्यादा काम करना पड़ेगा and it will be very tiring process. ये perception सबसे ज़्यादा change करने की ज़रूरत है.
I guess so is having some network issue. So, Hina ma'am, can you tell me about your experience as you are intern right now and your internship period is going on?
Yeah, presently I'm doing internship in one of the nicest hospital, which is Shalby Hospital. You must be knowing Shalby has many other branches in other cities also. Uh,
Yes.
So presently over there we are having almost the ortho cases like bilateral OAD, hip replacement,
Mhm.
knee replacement and all such cases. So yeah, as Ashish mentioned before कि हम internship में workload होता है वो वगैरह. Being an intern, I came to know that's wrong. It's not that tough for interns to. Yeah, you have to work, you have to concentrate just because है ना हमें ही सीखना है हमें ही करना है तो है
Hmm.
ना तुम्हारे ऊपर कोई लोड नहीं है इट्स जस्ट यू हैव टू लर्न योर स्किल्स यू हैव टू डेवलप योर ओन स्किल्स सो या आशीष यू आर सेइंग अबाउट
Your
Yes,
experience, sir.
yeah, my experience. So, the Sancheti Hospital has nicest faculty. They have the nicest staff, be it IPD or OPD. So what
Yes.
they used to tell me is that they never used to put too much workload on us. They always had learning oriented experience for us. So they were saying तुम लोग यहाँ सीखने के लिए आए हो, तुम लोग यहाँ drones की तरह काम करने के लिए नहीं आए हो. That was a wonderful experience. And
Mhm.
once you start observing them treating the patient, and you learn many new things. Like we were seeing a patient of acetabular fracture post surgery, and she asked me a question regarding how will you strengthen the quadriceps of patient as you cannot give dynamic quads in sitting position. So I
Yes.
was wondering how we can strengthen the quadriceps. So she just lowered the leg in lying position only and strengthen the quadriceps
Oh, wow.
in that way, because we cannot do much hip movements in acetabular fracture recently operated. So,
Yes.
you learn a lot of creative things during your internship from your mentors. It's just that every member of your mentors can add value to your internship. Some or the other way, you have to find out how that mentor is adding value to your internship.
Yeah,
And
plus everyone have their own technique. तो हमें पता चलता है कि how you treat them like this, how you treat them like this by working with
yeah.
groups of different peoples over or around you.
Yes, so there was not one mentor during my internship. There was different mentors in different departments. So you have to understand how each mentor is trying to mold you uh, in a way that you learn more.
Yes. So,
So
have you guys got like words from your resident or any of your mentors?
can you repeat the question, Neha?
I was asking during your internship period, for example, if you do any mistake, there are two kinds of mentors. One who explain and makes you understand very well by
Yes.
instead of giving you words, and second one is like the mentors or the residents, that is
Hmm.
postgraduate students. They directly
Yes.
they will bash you and they will give you words like, oh, you are not doing like this, it is not done like that. Have you guys ever experienced that kind of things?
Yes. I have experienced these kind of things. But everyone makes mistakes. Unless and
Yes.
until you're not causing any harm to the patient, you are bound to make mistakes as a human.
Yes.
But how you take that criticism is up to you.
Yes.
Whether you want to take it in a constructive way or destructive way totally depends upon you.
Yes.
And that doesn't mean that you have to put your head down and listen to everything they're saying. You need to put up your point somewhere, but the criticism, how you take it is up to you in a constructive way or a destructive way.
Yes. Uh, in our side, actually, most of the places we had hospitals. So there, they don't poke us in front of patient. When we come
Hmm.
out, they teach us there only. Okay, you don't have to do that. Like, so yeah, it's up to your resident or your mentor. It's also up to them also. Okay, how they
Hmm.
or how they poke you or how they make you learn. So I guess that also matters. So अगर वो तुम्हें आके अगर तुम्हारा पेशेंट कंप्लीट हो जा रहा है फिर वो तुम्हें आके बाहर आके बोल रहे हैं तो डेफिनेटली वी आर गोना फील गुड कि हाँ देखो उन्होंने मुझे
Hmm.
4 लोगों के सामने नहीं बोला. और अगर तुम्हारा मेंटर तुम्हें 4 लोगों के सामने बोल रहा है तो भी यू हैव टू एक्सेप्ट इफ यू हैव डन समथिंग रॉन्ग.
Yes.
So I think
Yes.
in front of patient also अगर if your mentor are poking you then you have to accept and you have to I guess apology for your mistake and you have to learn whatever
Hmm.
thing you have done wrong. So nothing is wrong
So
by your
yeah.
resident doctor.
So what I used to do during my internship now, when patient was walking with the walker, I knew patient is not gonna fall. So
Yes.
sometimes I used to walk ahead of the patient. So my mentor told me that never do that. Always stand behind your patient when your patient is walking. So
Yeah.
you can grab him when he can fall. You have to support him. So
Yes.
these small things are necessary to be taught, you know,
Yes.
during your internship. So
Yes.
they you have to you will make mistakes, but you have to own up to your mistakes,
Yeah.
not cover them up.
तो थिंक कि भाई मुझे इतना बोल बोल कर रहे हैं मैं नहीं
Hmm.
सुनूंगा हर चीज में तो क्या है बट दिस आर द स्मॉल थिंग्स दैट मेक्स यू परफेक्ट जो आशीष
Yes.
ने कहा ना अभी हमें हमें ये हमारे इंटर्नशिप के फर्स्ट मंथ में ऐसे बताते थे कि यू हैव टू डू लाइक दिस
Hmm.
बट एट प्रेजेंट आई एम हैविंग माय लास्ट मंथ ऑफ
Hmm.
इंटर्नशिप so yeah now I am on this small in this small things now I am perfect now I know कि हाँ पेशेंट वॉकर के साथ चल रहा है तो मुझे पीछे चलना है. Why? Just because I got poked by him or her in first month of the internship, which is that's better now. With this situation. So it's up to you how you have to accept it. They are telling you, or they are poking you, or they are shouting on you. I guess yeah,
Hmm.
only for them. So we have to work hard.
Faisal Sheikh is asking MPT ortho or MPT neuro. So you can check out ortho versus neuro live on my page. You'll get good
That
insights on that.
that
Yeah.
live was fun and very informative too. So let me ask you another question. Ina ma'am, this is for you. Like, what are the challenges which you face during your internship?
Firstly, frankly, I speak. Whenever we got to the another hospital on the very first day, this is seriously so us. You don't know anything about the place. You don't know any rules of the hospital. You don't know anything about the staff or doctor or what kind of the doctor are there, on what timing they are coming, what are the protocols followed by their hospital, or anything you don't know. So it is so important your first day in that hospital or that clinic, because at a point you get nervous ki, to whom I should speak, how to speak, what to speak. So yes, these are so important points or topics. Do I have to speak directly to the patient, or do I have to first ask to my resident?
Sorry.
So I guess first day is very important. First, calm yourself. Then feel the vibes. What are your vibes around you? Then I guess now I got learned. Okay, what to do on your first day. Just go and ask when your resident is coming from the staff area or staff people. Then
Yes.
then if your doctor is coming, then you have to go to your doctor. Your doctor won't come to you. Oh, you are the intern here. Is your first day over here? So yeah, these are the basic things. You have to go to your doctor. You have to ask what kind of patients are here in this hospital or in this ward, or what are the protocols you guys follow after the surgery, like after TKR, THR, what protocols you follow.
Yes.
And if you don't know, then you first ask, okay, can I have your help or can I have your assistance, so that you won't make any mistakes. These are the points from your side, that nobody will tell you, oh, come here, because now we are not the kid, like we have to handle ourselves. So in every place, on the first day, this is the major task we are done, and within 2 to 3 days we settled over that place, and then we know the protocols and all. So yeah, for me, first 2 to 3 days are so challenging, that how you will follow these rules and regulations over that place, because every place has different rules. Some people
I guess so. Manta ma'am is having issue. Yes, ma'am.
Yes,
Now
yes.
we.
uh, yeah, so some exercise protocols are up and downs in every hospital because of that orthopedic stuff. So yeah, 2 to 3 days are so important for me.
Yes.
What about you, sir? What challenges you faced?
Challenges is that no one is perfect in this world. No one knows everything. And
Mm-hmm.
when you go into a reputed institute for your internship in a big institutes like Sancheri and Rubyal Clinic, they expect you a certain amount of knowledge from you.
Mm-hmm.
And when you don't are not able to fulfill their expectations, so sometimes you might feel down. But and it might happen in other students internship as well, but that is the phase when you can step up your game, when you can actually enhance your knowledge. It is actually the opportunity in disguise to enhance your knowledge, which all things you don't know you can know. So
Mm-hmm.
that is the major challenge faced by, like, mentors will constantly bombard with you questions, and people often get nervous, but it is nothing to get nervous about. If you're not able to answer a question, that doesn't mean you don't have the knowledge. It's just go home, read that topic, and give the answer next day. It's not a problem.
Yes, this stuffs happen. You know, कभी कभी रेजिडेंट सोच कर आते हैं ना, आज तो इंटर्न्स की ले डालनी है, तो हो गया. They
Mm-hmm.
serious before this is about 2 to 3 days ago. Our therapist came, and he was like, oh, so you are intern here for this month. Me and Mayanda was like, yeah. He was like, done with the patients. We were like, yeah. He was like, oh, come sit. I want to ask you some few things. Like we were like, oh, मतलब seriously उस टाइम पे दिमाग में चलता है क्या पूछेंगे, because these are all entire 4 years. He might ask
Yes.
what he might ask, we don't know. Then he was like, do you know about antenatal, prenatal, and postnatal care for the pregnancy in physiotherapy? So, like, luckily I guess me and Mayanda got so happy because we are bit interested in that field, and we had this bit knowledge, so we were like, yeah, we know. He was like, tell me some few things you know before and after for both stuff. So yeah, there are some challenges you have to face. We got lucky. We had our favorite question.
So
Yeah.
I have two questions for you. The
Yes.
first question is, as Sancheti is in Maharashtra and you are from MP, there must be a language barrier, as maybe like in that hospital, villagers might have like
Yes.
to come for the
Definitely.
treatment. So how did you overcome that thing? How you used to communicate with the patient?
So initially I had some problem, but I started communicating in Marathi with the patient. I at least tried, and I
Mm-hmm.
learned as much as I can as soon as possible. The few terminologies like we call knee as gudga,
Yeah.
and like if you want to tell the patient that you have to bend your knee, we have to tell them gudga vakwa. So these small things you have to learn according to the region, right?
Yeah.
Mm-hmm.
So you get adapted with time. So it's like you don't have to be like that. Like you don't have to be very rigid. You
Mm-hmm.
have to be very like lenient with the things. You need to go on with the flow. किसी चीज
Yeah.
का भी टेंशन नहीं लेना चाहिए दिमाग पे, लाइक कि अभी लैंग्वेज प्रॉब्लम है तो मैं कैसे ओवरकम करूंगा, मुझे तो मराठी नहीं आती.
Yeah.
इंस्टेड ट्राई टू सॉल्व द प्रॉब्लम. एंड
Mm-hmm.
बहुत सारे इंटर्न्स का प्रॉब्लम सॉल्विंग अप्रोच नहीं होता है. दे गेट पैनिक्ड इजीली बाय द स्मॉल स्मॉल थिंग्स. एंड एवरीवन देयर इज टू टीच यू, नॉट टू पुल यू डाउन. ये चीज इंटर्न्स के लिए समझना बहुत जरूरी है.
Yes, at that time you feel कि क्या मुझे सब बोल के चले जाए, but that is good for your own only. वो तुम्हें
यस.
बाद में realize होगा when this same problem comes in front of you after a period, and you will be able to solve that. Then only you will feel, oh हाँ, अच्छा हुआ मैंने उस दिन सीख लिया.
यस
हाँ.
एग्जैक्टली.
एंड एक पॉइंट पे याद भी रहता है करके, क्या ओ उस टीचर ने उस दिन डांट के मुझे ये बोला था, तो फिर वो चीज हमेशा याद भी रहती है.
हाँ.
यस.
तो सर आप महाराष्ट्र में लाइक पूरे इंटर्नशिप के पीरियड रहे थे, कोई भी एक सेंटेंस बोलो मराठी में अदर देन फिजियोथेरेपी. कोई भी
अदर
एक सेंटेंस बोलो.
मराठी में लाइक इफ यू हैव टू आस्क आपका नाम क्या है, तो इट्स लाइक वी हैव टू आस्क तुझं नाव काय आहे.
हाँ सही. So second question again, it is for you, sir. As Sancheri is a private institute and private hospital also, I guess so. So
Yes.
बहुत सारे बच्चों के दिमाग में ये रहता है करके, क्या डिफरेंस क्या मतलब होता है एक प्राइवेट इंस्टीट्यूट से इंटर्नशिप करना और एक गवर्नमेंट इंस्टीट्यूट से इंटर्नशिप करना. लाइक इज देयर एनी लॉस और लाइक यू लर्न इक्वल थिंग्स या फिर क्या?
Actually, there are pros and cons to everything. So in government hospital you get a lot of exposure,
Yes.
but वहाँ आपको mentorship थोड़ी कम मिलेगी, because everyone don't have time to teach you or divert their attention towards you. So you have to learn things from yourself in a government setup, because there is, but exposure is humongous. Literally you get to see each and every condition in a government hospital.
Yes.
But it becomes limited in a private institution, because there are only certain type of cases. Like in Sancheti you will see 90% of the orthopedic cases, so you will get only most of the orthopedic exposure, but you will get a awesome mentorship. Like you will be guided for each and everything. So like everything has their own pros and cons.
Pallavi ma'am is saying that she did her internship from Sign Hospital and government hospital for internship is best. So
Yes.
as all the points you said, and as ma'am has also added her point. So
Yes.
what about you, ma'am? You are doing from a private hospital or like it is a government hospital?
No, yeah, most of our hospitals are private. As I said, going in which is private.
So my next question is like, what is importance of internship? Like in general, like important internship का क्या importance रहता है, और फिजियोथेरेपी के curriculum में as a medical students वो internship का क्या value होता है? हीना मैम?
वैल्यू इज बेसिकली देर इज सो मच वैल्यू ऑफ इंटर्नशिप जो हम 4 साल में नहीं सीखते हैं, उसका कुछ ज्यादा ही हम इंटर्नशिप में गेन कर सकते हैं. यू मे लर्न के मुझे किस चीज में मास्टर्स करना है. आप ज्यादा केसेस एक्सपोज करोगे तो आपको तब पता चलेगा कि दैट्स द वैल्यू ऑफ इंटर्नशिप. सम बेसिक एथिक्स, देन हाउ यू हैव टू टेक केयर ऑफ द पेशेंट, हाउ यू हैव टू ट्रीट सारी हो, कौन सी जगह पे कैसे प्रोटोकॉल्स फॉलो होते हैं, किस तरह की ट्रीटमेंट. एवरी हॉस्पिटल्स आर देयर ओन, लाइक 3 स्टार है, 4 स्टार हॉस्पिटल्स है, हर जगह है. तो हर एक जगह पे उनका खुद खुद का ट्रीट करने का तरीका अलग है. एट प्रेजेंट में हमने एक पहले न्यूरो रिहैब हॉस्पिटल क्लिनिक में हमने पहले वहाँ एक इंटर्नशिप की है. प्रेजेंटली आई एम इन द हॉस्पिटल. सो क्लिनिक के रूल्स अलग होते हैं, हॉस्पिटल के रूल्स अलग होते हैं, उनका पूरा प्रोटोकॉल अलग होता है. सो इट इज इम्पोर्टेंट कि आप न्यू टेक्निक सीख पाते हो, न्यू टाइप के आपके पास पेशेंट्स आते हैं, एक्सपोजर होता है. सो इट इज रियली इम्पोर्टेंट. प्लस फॉर योर मास्टर्स इट इज डेफिनेटली इम्पोर्टेंट. So I guess internship had lot of importance in someone.
I'd like to add something to that. It's that internship is actually preparing for the real life world.
Yes, correct.
अगर आपको 4th ईयर के बाद डायरेक्टली बोल दिया जाए यू स्टार्ट प्रैक्टिसिंग, इट्स नॉट पॉसिबल.
You won't. आपको
You
serious
won't be able to.
मैं क्या
And you won't be even confident.
Yes. So it's like it prepares you for the real world, the challenges that you will face in the real world, like time management, managing conditions, different conditions, and how to treat multiple patients at the same time, how to do the documentation, which is very necessary. Otherwise, you'll get into legal implications. So internship teaches you many things, many things.
So my next question is, where do we do internship? Like clinic, hospital, खुद के हॉस्पिटल में जहाँ से तुमने पढ़ा, या फिर किसी और भी हॉस्पिटल में तुम वर्क कर सकते हो, जैसे कि आपने किसी और स्टेट में जाके किया, मैम ने न्यूरो क्लिनिक में भी किया, अब हॉस्पिटल में है. लाइक सारे डिटेल में बता सकते हो ये?
मैं बता सकता हूँ डिटेल में कि इट्स दैट कि you cannot do your entire internship from a clinic. That's not possible.
Yes.
Okay. बिना हॉस्पिटल के एक्सपोजर के इंटर्नशिप का कोई मतलब ही नहीं है. एंड इट इज इन द रेगुलेशन दैट यू हैव टू डू योर इंटर्नशिप फ्रॉम अ 200 बेडेड हॉस्पिटल. ओके. सो अगर आपको आईपीडी का एक्सपोजर ही नहीं है तो आपको, अगर आप अपना ओपीडी फ्यूचर में स्टार्ट करते हो तो यू डोंट नो द हाउ व्हाट पेशेंट हैज गॉन थ्रू इन द आईपीडी सेटिंग. So how you will go treat the patient, and if you're not posted in a different departments, how will you come across different conditions in different departments like neuro, gynae, cardio, and we'll cover now each and every department. So we'll talk about it and I'll tell you about it in detail.
But what about the NOC, and what's the actual full form of NOC? What's the use of NOC?
So NOC stands for No Objection Certificate, which you have to get from your college if you want to do your internship outside your college. So that college has no objection of doing internship in some other state or other hospital than your own hospital. So some colleges give it very easily, like mine. Some colleges don't. So it totally depends on your college if they are willing to give you the NOC or not. But without NOC, you won't be allowed to do internship at any other place. So NOC plays a very important role if you want to do it from some other setting.
Pallavi ma'am is saying, my opinion is, if you get chance to do from multidisciplinary hospital, it's going to help you a lot. Also, if you get chance to take a externship, go for it.
So yeah, I did my second part of internship from a multi-specialty hospital only. So I got pure orthopedic exposure and in a multi specialty hospital as well. So it was a complete package exposure for me, to be honest. But not all colleges allow their students to go out.
Yeah, and I guess it is difficult to get a multi-specialist hospital while doing internship. So I guess in my college it is so good that we get internship 1 month in orthopedic hospital, 1 month in neuro hospital, So in our college, this way it is divided. So yeah, I am happy like this. In this way, it is only the multi specialist only. You have to do 6 months the multi specialist work. So this way also you can go for it. I did my internship like that.
Hina ma'am, you are working outside of your hospital college, like college hospital, like by taking NOC, it's or else it is from your college only.
No,
No, it's
this all
posting from
hospitals
their
are
college
government.
only.
Yeah, this all
Oh, okay,
hospitals
that's
are
nice.
government. And
So your hospital can also post you to other hospitals.
yes,
Mm-hmm.
yes. In
Like students of DY Patil used to come into Ruby Hall Clinic for a period of 1 month or something. So their college posts them. So
Oh,
whatever exposure is not available in their college, they send them to another specialty to get that exposure.
okay, okay. Now I get it. Pallavi ma'am also said like in my college only toppers could opt for externship, so I opted it. Even in my college, it's ruled that as far as I know that only top 20 students can opt for NOC.
yes, got and both got chance for NOC, but we didn't apply it, I guess, because our main motto was because of the COVID, because because we had inquiry in most of the hospitals, and we came to know that they won't give internship at present. When our internship got started, it was COVID was at peak, so they said like we are not hiring interns at this period. So we didn't went for that road, and we simply because and our college also giving us such a nice hospitals. So yeah, we chose that.
And
What about
actually,
your
it is very good to step out of your own comfort zone, your own college, to go into some other institution, because that steps you out of your comfort zone and makes your learning process more enhancing. So my like it's like my experience, personal experience.
Yes, at present we
I
even
I
went both are
I
for
would like to say that before internship I was a totally different person, and after internship I was a totally different person.
yes, some rules and time management, time perfections made you from this to this. Me and Mayan are
Yes.
facing so many difficulties for time management. We have to reach in the hospital at their time only. You have to keep things aside, and you have to reach first to the hospital just because your residence is waiting for you.
That brings me to the discipline part, which is very important.
Yes.
yes. इवन राइट नाउ आई एम इन माय थर्ड ईयर एंड 9 बजे के कॉलेज में हम लोग कभी कभी 9:10 को जाते हैं, 9:15 को जाते हैं. हमारे डीन एंड टीचर्स भी हमें बोलते फिर रहे क्या तुम लोग अब भी नहीं आ रहे हो, इंटर्नशिप में क्या हो गए,
क्या
लाइफ में तुम लोग
exactly?
डिसिप्लिन सीखोगे. सो
In
या
that
लाइक
ticket,
इट्स कोरिलेटेड.
yeah,
Guys,
in
if you have
that
any
ticket 10 minutes.
questions, I would recommend you to put them in question box so we have access to it later. So we'll take each one of your questions. So put your questions in the question box.
Yes, and before we go ahead, I want to ask Hina ma'am, do you still have a time constraints and restriction?
Yeah, I guess I can. I have to leave now. Sorry, I won't be able to join you more. Uh,
It's
but
okay.
uh, but it was
Okay.
good to talk about internship.
Yeah, and we are very glad to know about your experience, challenges which you shared with us. I hope like many students will learn and they will do better.
Yeah, go for it. Internship is such an important stuff.
Thank you, ma'am.
Okay, so I can go. Bye.
Yes,
Yes.
yes.
Bye, ma'am. Take
Bye.
care.
Bye.
So, as you are only over here, sir, I would say like if Physio Prem's Neuro Pallavi ma'am or Vakka sir, anyone is there in the live, and if you want to crash the live, please you
You are
can like
welcome
we
to crash our live
yeah,
session. We'd love
we
that.
would glad to have you over here and to know more points from your side. So my next question for you is like tips for more productive in the internship and during the internship, so that we can take more and learn more.
So first, discipline is very important. So you have
Mhm.
to reach the hospital on time, and you have to stay there till the time your posting end. You have to abide by the uniform rules or dressing rules, and you have to abide by the hospital rules. If you
Yes.
don't follow the rules, you will not be able to learn anything, because rules are absolutely important, and you should have that learning thing inside you. मतलब सीखने की इच्छा होनी चाहिए खुद से. अगर if you don't have the knack of learning, then you won't be able to learn anything. And also you need to have a good rapport with your mentors, because
Yes.
in the end they are going to teach you. So you need to respect them and maintain a good communication with them, and you need to understand that you are part of multidisciplinary team. So what is your role in that multidisciplinary team? You have to communicate with the orthopedic surgeons, residents, everyone. So yeah, that's my tips for internship.
What about maintaining a clinical book? Like whatever patients you are treating, should you maintain a clinical book when you are an intern?
डेफिनेटली इट्स कॉलेजेस में रिक्वायरमेंट होती ही है. डेफिनेटली वो बुक लॉग बनाना ही पड़ता है. So you have to document each and every case, whether it's IPD, OPD, regularly document करना चाहिए आपको हर केस को. एंड ऑल्सो दैट ब्रिंग्स मी टू द प्रोजेक्ट पार्ट कि आप प्रोजेक्ट पे भी आपको ध्यान देना है. इंटर्नशिप के टाइम पे सब मैनेज करना है.
That was my next question, like how to manage project work, both thesis वगैरह, and also when you are in internship, many students want to go ahead for the MPT. So how to do MPT preparation with, like during your internship period, and also like managing the project.
So ये 6 महीने पूरा का पूरा अपने आप को लाइक फिजियो वर्ल्ड में डाल दो. पर्सनल लाइफ को थोड़ा सा साइड कर दो. ऐसा नहीं है पूरी तरीके से भूल जाओ, बट थोड़ा सा. लाइक इफ यू वांट टू प्रिपेयर फॉर एमपीटी, तो रात को 1-1.5 घंटा 2 घंटा निकाल के आप एमसीक्यू सॉल्व कर सकते हो, बुक्स पढ़ सकते हो, सब्जेक्ट्स पढ़ सकते हो. तो वो चीजें आप कर सकते हो. उसके अलावा यू कैन ऑल्सो प्रोजेक्ट वर्क के लिए आप वीकेंड्स पे काम कर सकते हो. यू कैन विजिट वेर एवर यू वॉन्ट टू अकॉर्डिंग टू योर प्रोजेक्ट टॉपिक, and you can take the sample size and everything, and you can manage everything nicely. It's just that थोड़ा सा personal आपका life affect होता है, but it's important for your own good in the future.
Yes. And Pallavi ma'am has commented, logbook is compulsory and takes signature from department head. By this one incident,
Neha, I want to add one thing, that whoever are putting negative comments in the live, you are please welcome to leave the live. I don't have I'm not doing this live for your sake, so please leave. You're good to leave. Okay, let's continue, Neha.
Yes, 1 minute. Yeah. So Pallavi ma'am said you have to maintain a log book, and then you have to get
Yes.
it. So I do remember one incident. It is a recent incident. So I do have my clinical posting in 3rd year. So I used to see like my interns are like rushing or talking with each other, like, oh ma'am से signature लेना है book, and they used to take a. And I used to wonder, you kaun sa book hai? I thought like maybe it's project work. And now you have said, and even ma'am has commented, that it's a log book which you have to
It's
maintain.
a log book which you have to maintain. Yes, it is very
now
important.
I'm realizing that it is a log book. Yes.
Yes.
Now we are gonna discuss about each and every OPD, what we learn, and then what kind of patients do come, and those patients like kitna duration वो लोग लेते हैं. And
Yes.
so let's start with ortho, your favorite.
Yeah, my favorite ortho. So ortho exposure, like I said in my last live, that ortho physiotherapy is the core of physiotherapy. Like that, it's my point of view. So like ortho
I don't want to say much because Pallavi ma'am will comment. I'm low-key on every side right now. I'm still exploring.
So ortho physiotherapy में मतलब ortho exposure बहुत जरूरी है, because कई चीजें ortho के point of view से ही हमें समझाई जाती है. And you will come, whether you are doing any specialty in your life, you will come across ortho patients throughout your life. So ortho exposure is utmost for every physio out there, and I have done my internship from a best orthopedic specialty, so I have a good ortho exposure.
And also I remember that you have once said that Sancheri has even specialty OPDs in ortho, like spine.
Yes,
and
yes, I was about to go on that.
Yes.
So like in IPD, we had 4 different departments. We had a trauma, we had hip, we had knee, we had spine. So, every department we learn new things. Like in trauma, when we used to like bed transfer the patient from wheelchair to the bed or bed to wheelchair, I
Yes.
used to like I was bad at counting and I was a little bad at transfers. But when I was posted in spine, I became pro in transfers.
Mm-hmm.
So when I went back to trauma again and I was doing a transfer, ma'am was like, "You have become a good at transfers after working in spine." So each and every department, like in knee, you become like acclimated with the protocol of TKR, and in hip department, you get to learn about the protocol of THR. In knee, you get to know about ACL injury rehab and different rehabs, meniscal rehab. So you'll get to learn a lot in ortho. Like possibilities are endless, literally.
So now I have one myth busted question, or like I don't know, people say that is a myth, or like it is a truth. You are the one who is gonna say. So ये सच है क्या ऑर्थो में खाली शॉर्ट टर्म वाले पेशेंट आते हैं या फिर ऐसे भी कोई केसेस होते हैं जो लॉन्ग टर्म होते हैं?
It
What's
totally depends on the condition of the patient. Some patient have multiple conditions associated with them, so they take long time in rehab. Like if a patient has gone through a PFNA in the left hip and he has osteoarthritis in the right knee, he also has a frozen shoulder. Together, all of these conditions, if we are going to treat together, it will take a lot of time.
yes.
It's not magical. So ortho rehab also takes time, depending
Mm-hmm.
on the comorbidities and taken everything into the consideration. And some patients are young and have no comorbidities, no associated conditions, so they get recovered very fast.
So our next OPD is neuro OPD. But before that, I want to ask Pallavi ma'am if she is available right now so that she can join and she can tell us about the neuro OPD. And if she wants some time to get ready for the live, then we can save this neuro OPD
Yes,
for later.
yes,
Yes. So
neuro OPD
let's
is
go.
reserved for Pallavi ma'am.
Yes. So Pallavi ma'am, we want you in the live. So let's move on to our another OPD, that is cardio OPD. What kind of patients come? What kind of patients you usually see, and what you have learned?
So I have mostly seen CABG cases during
Mhm.
my Ruby Hall clinic internship. And oh, Pallavi ma'am can't join right now. We'll wait for you. Otherwise, we'll discuss neuro also. No problem,
Yeah,
ma'am.
we will wait. We will discuss all the OPDs you have that time.
Huh. So angioplasty patients or CABG patients. So I've seen mostly surgical patients in the cardio, and cardiac rehab is completely different than any other rehab. Like
Yes.
uh, you have this protocol when you have to do different activities day wise, like when you have to make the patient sit, walk,
Mm-hmm.
then when the patient is able to do different activities, then you can rehab, like progress the patient further. So if a person is interested in cardio, so there are lots of possibilities right now. Like ICU में कार्डियो फिजियोथेरेपिस्ट की काफी जरूरत होती है फॉर द
Huh.
cardiorespiratory care of the patient, because even in neuro cases also, as Pallavi ma'am's one post says, that you save the chest, you save the patient.
Yes.
So like chest care, cardiorespiratory care is of utmost important, be it any condition, ortho, neuro, cardio. So it's
Mm-hmm.
extremely important. And
So I,
also you need
yes, sir.
to know how to assess from a cardio point of view, be it any patient. You should be able to auscultate the patient. You should know how to perform percussion. You should know how to uh, assess from a cardiorespiratory point of view. Otherwise it becomes very difficult. Like इवन ऑर्थो केसेस भी हम देखते हैं, अगर हम कार्डियो रेस्पिरेटरी पॉइंट ऑफ व्यू से असेसमेंट नहीं करते तो कई चीजें मिस हो जाती है.
Mm-hmm.
तो हमको हर पॉइंट ऑफ व्यू से पेशेंट के बारे में सोचना होगा. ही माइट बी हैविंग एसोसिएटेड रेस्पिरेटरी कंडीशन, जिसकी वजह से मेरा ऑर्थो रिहैब इतना अच्छा होने के बाद भी पेशेंट की हालत में सुधार नहीं आ रहा है.
Hmm.
So yes, and also this makes me remember a funny incident. I'll take a little bit of time.
Yes.
So what happens is now when we give percussion to the patient in the ICU, there are leads attached to the patient.
Yes.
एंड ये चीजें प्रैक्टिकली करने के बाद ही समझ में आती है कि जब हम उसको परकशन देते हैं ना तो वो लीड्स हिलते हैं. तो मॉनिटर शोज टैकिकार्डिया, but it's not actual tachycardia because leads are misfunctioning because of you percussing the patient. So first day I was doing the percussion and मुझे लगा their heart rate 230 240 तक चला गया and I was very worried. तो मैंने percussion stop किया, वो patient का complete किया सारा manual and I went back to my mentor and I told him about it and he's like, why you're worrying about it? It's just the leads. It's just because of the leads. Patient is not going into tachy. Why are you worried?
Yeah, and I have heard one term that is acute care rehab, जो कि foreign countries में use होती है. Is it same for the people who is working in ICU or like it's totally different? Acute care rehab.
Acute care is totally like it's there in multi-specialty hospital. Yes. So acute care is very important, be it ICU or be it the IPD itself, because patient can develop a chronic pain or chronic conditions if acute rehab is not taken into consideration. Yes. So that was my answer to it.
So let's move on to another OPD, that is Pedia OPD.
Yes. So I was posted in Pediatric Opd for 2 weeks, which was not at all enough because there is so much to pedia, so much. Like you have to be brushed up with everything like prenatal, postnatal, and everything. Pallavi ma'am can join now.
Let me accept her request. Yes, Pallavi ma'am.
Hello.
Hi. I am not going to take a lot of time because I am with my sister right now, and my little niece is here. She wants to play with me, so I am not going to take a lot of time. मी काम करते गा. हाँ. So, what questions you have for neuro internship particularly?
Neuro OPD, just tell us like what kind of patients do come and what you actually learn during your internship period.
Okay, so during my internship, luckily my am I audible? Am I audible? Okay. So luckily, see, I wanted my neuro posting in my institute itself because of my neuro professor. So luckily, I got that because the entire procedure for externship took 1 month. And because of that, I could finish my neuro posting in my institute itself under my mentor. And then I was shifted for my externship at Sion Hospital. So usually throughout my internship, I would say my entire internship, 4 weeks time in neuro posting, we did a lot of assessment. We were more involved in during our posting. We were more involved to assess the patient rather than actually individually treating the patient. So we always used to have our PG seniors who were treating the patients individually, and they used to ask us to assess the patient thoroughly. So I think my internship really went in, what you say, neuro posting really went in assessing the patients. So when you are assessing a neuro patient, you can build up the the therapeutic strategy a little bit better. So I think in your internship, see maximum patients, whatever you can see, and whatever you can assess, reassess, reanalyze. So I think that should be the aim of your neuro posting during your internship.
I'd like to share my experience in adult neuro OPD. So when I was doing the adult neuro OPD I was not interested in neuro much. So when I got into the neuro department, I got to know there is so much creativity in that field. I got to know about the creativity, and I was asking to one of the seniors that can I get a book or something in which you try different exercises, that exercises are mentioned in a book. It's the senior told me it's not something given in a book, single book. You have to use your own creative mind to make the exercises more challenging. Like we used to treat SCI patients on Bosu ball, and we used to play catch and throw with them. So that was the level of creativity I learned in the adult neuro OPD. And also that was also
Absolutely.
there was also language barrier there as well, because in adult neuro OPD we used to have patients from Yemen, so I had to learn
Oh,
Arabic
okay.
for that. So it
Correct,
was a
correct.
totally
No, I think when you're posted in neuro OPD during your internship, I think your aim has to be to get exposed to a lot of patients, IPD as well as OPD.
OPD.
Because IPD protocols are different, OPD protocols are different. IPD assessment is different, OPD assessment is different. So I think learn everything, how to assess a patient who is in the ICU under a neurological circumstances, and how to assess the patient in the outpatient department. So I think for the neuro postings, I think focus really on understanding the, how to assess the patient, what all, I mean, you can clinically correlate, go back, read, and then correlate whatever you have seen in your patient. Also, my internship project was also neuro. So I was doing a lot of my project work as well because my project was itself in neuro. So I had to, my project was to see which fatigue scales are better in stroke patients. So I was doing my project work throughout my internship, but my major work, whatever I was doing in my posting was that I was actually doing a lot of research on which fatigue scale is better to assess the fatigue in stroke patients.
Yes.
So because my
And
project was in neuro.
also knowledge of different scales in neuro is very important if you are posted in neuro OPD, like the
Correct.
Rancho
So what
Los
you can do
Amigos
is
scale.
you can learn how to use the different outcome measures
Yes.
in neuro postings during your internship, because that's like the first step for your clinical journey, right? Whatever you're going to take later on, and see a lot of patients. Simple cases you can treat individually, like Bell's palsy. Some of the cases which are a little easy to manage, there are some transient ischemic attacks like stroke, which are not very difficult to treat. So that you can definitely, go ahead in your neuro postings, and obviously discuss with your master students or your professors when you are treating any patients, if they are giving absolutely individually. Abhishek is here. I am with Physio. The
Yes.
topic for today's live, I have crashed the live. I was not supposed to be in the live. The topic for today's live is how to make more, like, most of your internship, what you should do and what you should not, where you should focus during your internship. So that is the topic for today's live, and I crashed the live because they wanted my insight for the neuro postings. If that's clear to you, Abhishek, and if you have any insights, then you can put it in the comment section. They all can
And
read
we
and go
will be
through
glad
that.
that if you will join, sir.
He won't join.
Yeah,
Victor won't join the
I,
live, but he might put.
I'm really glad even Abhishek sir is watching this live.
He must have seen me go. I have gone live, so maybe
yeah.
he's must have joined. I don't know, but he won't obviously come live. But he can, if he wants, he can put some points, some tips for internship, basically.
Yes.
If you're watching,
I feel that
any
neuro post is the best to use your creativity for planning
Yes.
exercise and its progression.
Definitely.
observe a lot of things in your patients when you are posted in neuro OPDs or neuro IPD, because nobody is expecting you to treat a stroke individually in your internship. Nobody's expecting you to do that. So what they really expect is how you handle the assessment part, and then maybe you can discuss the assessment part with your professors or your master students and MPT students, and they can guide you for the treatment.
Yes.
Also, we were involved in a lot of case presentations during the internship as well.
I was too. I was given SCI for my uh, case presentation, and I messed up.
That's okay. We all have been there. We have been there. We have done that. We all have messed up lots of things. So it's okay. It doesn't
Yes.
matter as long as you are making mistakes and you are rectifying it and you are understanding and learning from those mistakes, it's gonna give you a good outcome.
Yes.
And Mridul is also saying be
Yes.
shameless in asking questions.
Yes, I was completely shameless in asking questions during my internship. And
And
that's how
also,
I got
I
to
want to put
learn.
up a point here that Ashish, you are absolutely speaking sense. So do not, do not give any reaction to trash comments ever in your life. So even if
Yeah,
anybody is putting
I
any
was,
negative comment, do not change your body language. First of all, do not get don't feel anything that someone is putting a trash comment. Just bypass those comments because those people really want your reaction, and if you
hmm,
give them the reaction they will again and again do the similar things. So you're
yes,
talking absolutely sense. You are giving absolute perfect examples, and tips to manage your internship or to learn best out of your internship. So don't get distracted with negative comments.
yes, I'll take a note on that definitely.
Do not change
I
your
want
body
to say
language.
something on this. I have learned this in my life. मैं ऐसे ही बोल रही हूँ in my life as if I am the like oldest person. So I have learned even if you do something good, people gonna talk and people gonna say. Even if you're not gonna do anything or even if you're gonna like fail or do anything bad,
It's
still they're gonna
totally
talk.
fine.
Actually,
I have come like
today,
this. I have come like this in the, I have crashed
my,
alive in this,
my
whatever way
point,
I am sitting right now. So it's totally fine.
my point of view to give them reaction was because that I don't want them to get away with what they've done for now, because they're not allowed to put trash comments in a informative life. So that was my point of view. But I'll make sure next time I don't give reaction to trash comments.
Correct.
Someone
Don't
saying
change your body language and don't react that way. What you have
Yes.
reacted in front of the camera is right, but don't get carried away.
Yes. Pallavi's neuro queen. I don't want to look like a chess pawn in front of her. Her knowledge is impeccable. I blindly agree with whatever she says.
Abhishek, please, please, your insights
Uh,
really matter.
please
So
individually share your mission. What kind of mission are you talking about, physio study?
I don't know. I didn't understand. Do you have any questions related to neuro postings per se?
For now, we don't have any questions in the question box regarding neuro specifically. But your
Correct.
insight was really helpful for us, for
Yeah,
the
and
students. So,
anyways, during the initial years of your career, if you are choosing neuro, you have to focus more on the observation part
yes.
and observe, learn, unlearn, and focus on that actually. Why Neha is moving around?
Hmm.
I stay in
Learning,
hostel and people was knocking
keeping.
on my door, so I went to open the door. Hostel things.
What are
Okay,
your
okay.
goals? What are your goals, Neha?
My goal is to graduate first.
My goal is to play with my niece right now and then sleep because it's
Yes,
weekend.
ma'am. Thank you for giving us some time and giving us some
Yes.
input. Now
Okay,
you can
you
have
guys
your
continue.
family
You
time.
guys continue with the other postings. And only one point I wanted to mention is regarding the externship experience I had. So I was in Sion Hospital. After my neuro postings, my rest of everything, every other posting I have completed in Sion Hospital, and my experience was amazing. Because I had to see a lot of cardio cases which were otherwise it was not the exposure was not there at my institute.
Ma'am,
So from
there is one question from neuro point of view. Ma'am, I have a question regarding neuro physiotherapy, especially how much we can earn in hospital setup in Mumbai.
it depends whether you are a fresher, whether you are a experienced MPT or you are a BPT with some certifications like NDT, PNF, and all of that. But from 30 to 40K in a hospital setup, you can expect the salary.
Okay.
Uh, at least for a fresher MPT, I would say. I'm not sure about whether hospitals are taking BPTs because they do need MPTs here. Some of
Yes.
the corporate hospitals.
Yes. Definitely. Mostly
Okay,
for
so
neuro OPD, neuro physiotherapists are preferred. Share your
yeah,
goals
obviously.
usually how you want people want to take physiotherapy to next level. His question is that share your goals individually, how you want to take physiotherapy.
If you ask my short-term goal in terms of the professional value, I want people to stop doing the bullshit workshops what they are attending and they are wasting their money in, and start really looking out for a quality healthcare in terms of our profession. When our profession is concerned, please think about the quality care are you providing that, and please don't run behind the money. So I am to doing every possible thing to educate people, educate students, educate clinicians who are newbies. So that is my goal of my entire social presence is for that, for in whatever way I can educate people.
And my goal is to change the perception of the general population regarding physiotherapy as well, and as well as educate students that instead of focusing on the negatives, focus on the positives and what positivity with you can bring to the profession. Because
What is
we
she Pallavi ma'am आने से क्या
सब लोगों ने ज्वाइन कर लिया
से सारों से पल्लवी मैम के आने से सारों से ज्वाइन कर लिया मीन्स
मतलब many people joined after you came into the live session.
That is a Hindi word like all of them or many of them, you can say.
So it's like that we always see the glass half empty, but we don't see the glass half full. That is the problem of in our profession. So see the glass half full, not half empty.
Yes, even
Correct.
like being a student and being on social media, as I make videos on physiotherapy, many pre-PT students ask me like make video about physiotherapy, like physiotherapy क्या है? And I'm like मैं खुद सीख रही हूँ physiotherapy क्या है, because अभी भी 4th year में है ना, बहुत सारी चीजें जो कि मुझे पता नहीं है physiotherapy के अंडर आती है. इवन इन सेकेंड ईयर इलेक्ट्रोथेरेपी मोडालिटीज मेरे लिए पहले, फिजियोथेरेपी में एडमिशन लेने से पहले बस 2 ही मोडालिटीज होती थी, वो है NEMS एंड देन होता था टेंस और IFT. मैं फर्स्ट ईयर में आने के बाद मुझे पता चला ओ फिजियोथेरेपी में और इतने सारी चीजें, सेकेंड ईयर में ओ और आ गया, और थर्ड ईयर में अच्छा ये सब भी.
You have a long way to go, and
Yes.
when you will be graduate and you will come as a practitioner, there are going, I mean, things are changing, right? So you will see a little bit different scenario. I hope so.
Yes.
You will see a little different scenario, and if you go to do masters immediately after your BPT, so वो एक और additional 2 साल तेरा चला जाएगा, right? So उसके बाद
Yes.
में जब तू वापस MPT करके आएगी तो चीजें और change हो जाएगी.
नेक्स्ट 10 years में फिजियोथेरेपी बहुत बूम करने वाला है गाइस, बहुत ज्यादा बूम
Not
करने
even
वाला है.
10, I would say, even less than 10.
Less than 10. Okay.
Because if a neuro, particularly neurophysio, you guys are here, shut up, Abhishek. If a neurophysio on social media can have, can gain a follower base, then obviously people are more, aware about our field.
Yes,
Or
definitely.
there are students who want to know, right? There are students who want to know what physio is and how we function, or that is the reason we get the DMs, right?
Yes. And also I'd like to share my experience. How can you enhance the learning during your internship process?
So I
Is
think
that-
I'll just go and
Okay.
you guys can continue,
Sure,
because
sure.
I'm actually looking very, very horrible right now, and I'm feeling very ajeeb.
No, no,
to sit here
you
with
look
my-
you look absolutely stunning, ma'am.
No, I'm sitting here with my niece's bunny
Bunny.
and so many toys here. So I'll just go and I'll play with her.
Yes, you have your family time.
Okay.
Yeah, okay.
Yes.
Bye. Thank you for your
Bye.
insights.
Bye bye. Take care.
So Neha, as I
So-
was telling about my experience, is that
Yes,
willingness.
before we go ahead, I want to say that we have more 15 minutes, so we have to wrap up with
Yes,
the
wrap up.
gynec, rehab, and onco.
Okay. Okay, let's continue with that then.
Yeah, we were discussing about the pedia OPD, pedia posting.
Okay. So in many cities, where are you practicing? Yeah, where will you be practicing? Not every city has a pediatric specialist physiotherapist. So many pediatric cases will come to you, and you will not be able to refuse those cases. So you ought to have a pedia exposure, that how to deal and treat pediatric patients. So it's like every posting has its own importance.
Mm-hmm.
So take interest in every posting. So that was my take on pediatrics. And it's a very vast, 2 weeks were not enough, really.
Yes.
You
And
can even
when I,
take a
yes.
pediatric fellowship for 3 months in Sancheri if you are interested in pediatrics, guys.
Mhm.
Yes.
Oh, that's a new thing. Even I was not knowing about
You
this.
can
That they.
even do orthopedic fellowship and pediatric fellowship from Sancheti after you have completed your BPT
Oh wow, that's
for three
really.
months. Yes, you can.
Mhm. So in fellowship, okay, yeah, yeah, I got it. So now our next OPD is gynec posting.
Gynec. So like gynec posting का importance ये है कि when a patient who is pregnant comes to you, you need to assess the patient very nicely.
Mm-hmm.
Like there are many associated conditions with pregnancy like diastasis recti or pelvic floor dysfunction. So you ought to have knowledge about these things and about the irregular menstruation and how physiotherapy has a role to play to regulate the menstrual cycle and everything. So you get to learn a lot in of that in gynae department.
Mm-hmm. I saw one post like long time back. I guess so from some gynec and obstetric page or like women health page. उसमें ये था करके क्या? Always people say that your pelvic floor muscle should be tight, like because women में usually pelvic floor muscle weakness या फिर lose हो जाता है. So फिर उसमें ये भी था लिखा हुआ करके क्या जो बोला जाता है not every pelvic floor muscle like tight or strengthening is good during pregnancy, so you should also have a good knowledge about it, I feel
Yes,
so.
assessment is important, right? So
Mhm.
pelvic floor dysfunction eventually can lead to a prolapse,
Yes.
prolapse. So it is very important problem which you need to take care of as a physiotherapist. So you
Mhm.
need to know the anatomy of the pelvic floor and how to assess the pelvic floor dysfunction and how to treat pelvic floor dysfunction.
Mhm.
Whether you are from any field of physiotherapy, because there might be patients coming to you, pregnant patients coming to you with low back pain, and you have to deal with them. You need to know the precautions, contraindications, and the assessment. So every department is associated with each other in one or the other way. So like if your field of interest lies in orthopedics and मैं सिर्फ ortho पे ध्यान दूंगा, बाकी departments में तो मैं बस ऐसे ही like for the namesake जा रहा हूँ, तो वो काम नहीं करेगा. You need to have knowledge of each and every department.
And one more reel I have seen, like जो pregnant woman होती है, baby का भी weight आता है, and then I don't know if it comes under physiotherapy or what. Like for example, a piece of
Underweight.
cloth, yeah,
Underweight.
no, no, not underweight. Like woman है and then she is pregnant and baby का weight आता है stomach पे. Okay,
Okay.
like womb. And then एक बहुत बड़ा piece of cloth रहता है, like just like दुपट्टा kind of, and then they wrap up around the womb so that that weight of baby can be lifted up and वो back पे थोड़ा कम pressure आए.
Yeah.
I don't know if it is done in India or not, but I guess so. I have seen this in like one of the foreign physiotherapist page.
So yeah, there are different techniques to manage the back pain during pregnancy, and it might be one of them. I don't have much insight about this technique, but if it is posted by a physiotherapist, it might be correct.
Yeah,
But there
I
are
will share you later after this slide.
But there are different ways the back pain can be managed during pregnancy. Yes.
Now let's come to our another next topic, that is onco posting.
Yes,
This
on
was
posting, this is new to you, but in Rubiol Clinic, there was a cancer ward, dedicated cancer ward, 3-floored, and we used to have a posting there, and we used to rehab the cancer patients. So cancer is associated with lot of muscle weakness and lot of joint pain and everything. So you
yes.
need to have a assessment from an onco point of view that which part which part has the tumor in the body, and which all functions of the patient are affected, what ADLC is not able to do, and you have to take your rehab protocol in that way from the onco point of view. And there are a lot of universities who are offering MPT in oncology nowadays. So it's in MGM Indore, MPT oncology is available. So it's next booming field in physiotherapy, which one can opt for. And onco exposure is very important because you will come across cancer patients in your OPD as well in future. So
Yes.
the assessment and rehabilitation is totally different. Like you have to keep up with their chemo when the chemo was done last, and after chemo the patient is very fragile, so whether to take the session or not totally depends on the physiotherapist knowledge about the oncology. Yes.
Yeah, and I feel so while treating onco patient, we also have to understand about the psychology of the patient, because that time
Yes.
patient is very stressed and even sometimes patient is depressed.
Yes, it is a fact, and you know, like how we use psychology in our physiotherapy field. So same you have to use with your onco patients and how to make them feel better. So yeah.
I'm so sorry, my roommate is behind the camera and she is cracking jokes over here. So
Okay.
now let's move on to our another posting, that is rehab posting.
Community posting. So
I don't know what is the other name, but I guess so. As you said right now, it's a community posting.
so there are a lot of diseases which are prevalent in a community. Like for example, if a community of poor people does not have access to the nutritious food, so there will be cases of malnourishment in them, or obesity, or different problems associated to malnutrition. Like kids will have problems like kwashiorkor or marasmus, something like community. These are the community diseases, right? So certain diseases are prevalent in community. So for the understanding of how community health works, community posting is important. So you are posted there for a year continuously, like you are posted in an old age home or a different setting like a care house of people with cerebral palsy, kids with cerebral palsy. You might be posted there. So you can understand about how community healthcare system works. And not only physiotherapists are posted there, many different healthcare professionals are posted in community healthcare.
I have good news that now we can like stretch our life as much as we want. So yeah, we covered each and every posting and OPDs. We have a few questions in
Yes.
our. Uh,
I was feeling very bad. We were not able to take as much as questions, and I'm excited to take your.
in the middle of the live session, I was like, okay, like should we first take their question? What if they leave the live before they get answers?
Yes. So guys, we are
Yeah.
taking your questions now.
Yes. I hope you can see the question, sir. You can choose the question you want to.
In case our institute not allowed to get affiliated famous hospital, is there any other procedure? See guys, NOC is very important. If you can't get NOC, then it's very difficult for you to get like your internship in some other hospital. Your roommate is quite distracting you, Neha.
No. The right now a person with snacks came, and so I was asking like, oh, are you going to buy snacks right now? Because we get a many midnight crunch. That's why. I'm so sorry.
Abhishek sir has put up a comment. I just like to throw something out there. You can get the highest degree and still be an idiot. Invest your time in theory, follow a mentor, and develop your critical thinking. That's really true, guys. That's really true. You need to learn a lot during your internship. And in physiotherapy, you have to be always a learner. You have to have a learner attitude, whether you have completed a master's or PhD. Whenever you drop that learning attitude from you, you will never be able to grow in the field of physiotherapy. Always have a learning attitude. Okay. MPT in India or abroad, want to know in your point of view. So as I've said in my roadmap to master's life, is that if you want to settle abroad, then only it is beneficial for you to do a MPT in a foreign country. Otherwise, if you have plans to come back to India, then it holds no value. Can we practice taping without certificates? No comments. Study hard, or do nothing. Is there any council for PTs, and is IAP membership necessary? So there are certain state councils, and the national council is in the process, and IAP membership is not really necessary.
It is not necessary, but like if you're planning to move abroad, most of the institute or that country ask you for IAP registration.
Yes, so it depends on what are your future plans. So it depends on your future plans that whether it's necessary or not. Which is the best specialty according to you in terms of number of patients? So you see, there is no best specialty in, although I've done ortho versus neuro, but there is no best specialty. Total depends on your field of interest. You go with your field of interest and you will get many patients in the future. You won't have to worry about if your skill is good.
Next question, sir.
Which is best college or university for PG? So, like guys, please watch Roadmap to Masters on Harsh Mali's Instagram page for a good insight of PG colleges. But totally depends on your field of interest. Like GNDU is good for sports, Sancheri is good for ortho. So it totally depends on your field of interest.
Sir has already made few reels on this. Then next question. How Sancheri Hospital choose the interns on merit basis or interview basis? So guys, if you want an internship at Sancheri Hospital, first you have to get NOC from your college, and then you have to contact with the concerned department like HOD of the college that you want to do an internship. Then you will have to submit a formal application through email or directly going there, and they'll tell you about if there is a vacancy for an intern or not, and when they will have a vacancy, and you can join. And you will be asked for a certain amount of internship fees, which you have to pay for doing the internship in that institute. That is the procedure. Ashish sir, which is good? Should we join a newly open physiotherapy college or should we opt for old one? So totally depends on the credentials of the college. Like you will need to have a research before joining any college, be it old one or new one. But I feel that at least the college should be 5 years older, and then I feel that it's better, even if it is a new physiotherapy college or institute, it should have other medical courses too. If it doesn't have other medical courses, then you will face problems in future, be it like in terms of patient or teachers or anything. So first, even if it is new, no problem, check for all the equipments, beds in the hospital, patients OPD, and then if it has the other medical courses or not. Okay, so you can choose any question. I think we have done all the questions. We have covered all the questions. Let's see if we have any questions in the comments. Rumi problems. What is the scope? Not only it is all fields. In AIMS Delhi. Question, do write in the comment section box or in the question section box. What? No, I'm just asking audience to write their questions in the comment section. Yeah, if you have any question, you can write it in question box or comments. So I'll share my experience. How can you enhance your learning during your internship? One point more. Yes. Then we'll take up questions. Is that the knack of learning comes from how like keen are you to learn? So in Ruby Hall Clinic, I was posted in diabetic OPD, which no intern was willing to take up. No single intern was willing to go there, and they were saying it's a waste of time to go into diabetic neuro, diabetic OPD. But I took it up. Firstly, I was also hesitating because no one was willing to take it up, but I took it. And it was a wonderful experience. I got to know so many things about diabetes,
like how frozen shoulder is very common in diabetics. What is diabetic neuropathy and how it affects the quality of life of the patient? Like many things from a physiotherapy point of view in diabetes. I used to take rounds with a diabetologist, very renowned diabetologist, Dr. Sanjay Agrawal, and I got to learn so many things from the posted resident and Dr. Sanjay Agrawal, and it was an absolute different experience. And I was able to learn how to counsel patients to take physiotherapy for diabetes. So that enhanced my counseling skills as well. So you know how you take an opportunity, like you take it as a waste of time or you make good of use of it, depends upon you. And the HOD of physiotherapy department was so happy with my performance in the diabetic OPD that she gave me the internship completion certificate 2 to 3 days earlier.
Oh wow.
Because pandemic was going on, I had to leave Pune. So I was given my ICC before because of my performance, good performance in the diabetic OPD, and she told me to mention it in the certificate. So you know, there's
To ask, what is ICC certificate?
Internship completion certificate.
Oh, that is again a new term and a new thing for me to know. I was knowing
So Surbhi Vohra is saying, which is the best physiotherapy workshop you have ever attended? So I've attended a certain workshop, but best one I've attended is a workshop on NDT, adult hemiplegics पे बोबा technique को कैसे apply करें by Dr. Prabhat Ranjan. That was a good workshop. I learned a lot about how to handle adult hemiplegic patient with NDT technique. So that was a good workshop I have attended.
I guess so. We have covered all the questions and also the topic which we wanted to cover in the like all about internship in physiotherapy.
Yes.
So, do you want to say anything or add up anything who gonna be interns in future or like who are interns right now? Do you want to like give them any advice or suggestion?
Yeah, I have certain advice or certain like tips for interns is that take your internship seriously, guys. Don't do it just for the sake of degree. If you want degree, so we have to do a 6 months internship mandatory. Take it as a learning opportunity instead, because that prepares you for the real life instead. So take it seriously, because otherwise you will not end up doing good. So internship is a very important stepstone in your career. So please take it seriously, very seriously. There is
Yes,
one question, I guess. How to deal with psychological challenges in neuro patients, especially SCI. So there are certain like functional difficulties and like psychological impairments in patients dealing with spinal cord injury. But during the rehab process, when you motivate them to do better, and when they are able to like ambulate on the parallel bars with the help of orthoses and braces, and when they actually progress with the rehab and they are doing certain activities by themselves, then they gain confidence, and that manages the psychosocial challenges. And I remember there was a patient of SCI and he used to drive scooty, and he used to feel confident while doing that. He used to tie his legs around the scooty downwards and he used to drive it, and that gave him the independence. So as much as you make your patient independent, and they'll be happy with your rehab. But if you're not able to make them independent enough, there might be some challenges. So try to make them more and more independent and motivate them.
yes. As with psychology, I want to say something. I even have psychiatric ward in my like hospital, and physiotherapy interns do treat them. I don't know much about it, but I just wanna tell you my experience. Like patients who are over there are already challenged with their psychiatric conditions, so we have to be like very gentle, as
Yes.
it is very tough to cooperate with them. So you have to be very good with the communication, and I felt so that day that it's not only about the communication, it's also about like how you make feel them and how like you bond with them,
So
because it will directly will affect their treatment protocol and like what can I say, like how
yes,
like soon they get treated or like what
definitely.
yes.
And that brings me to one more point, which we learned during the internship, is that soft skills. I
Yes.
have put enough emphasis on that already. That it is very important to develop soft skills, and internship is best time to develop your soft skills. I developed my soft skills during my internship. How to have effective communication with the patient, interpersonal skills, or different soft skills. So guys, you need to work on your soft skills during your internship. That's
Yes.
important. How to prepare for
Yeah.
second year? Patil Sonu, you need to watch the second year live we have done on my brown physio page.
Yes, guys. Whoever wants to know about all about like first year in physiotherapy or second year in physiotherapy, we already had a live session before this, and it's on my page. You can just go and watch. And if you have any questions, even after watching that, you can like be free to ask anything to Ashish sir or to me. And one question was there, Hiren was asking which book to refer for cardio and neuro PFT. For neuro, it's Sullivan, and for cardio, it's Pryor and Weber or Wilkins or Cash. But I feel so Cash, you should refer in fourth year, and Pryor and Weber and Wilkins is fine to refer in third year. So I guess so. We should wrap up now because
Yes.
questions will go on.
There is a comment from Abhishek sir. Somebody just posted which specialty will get more patients. That attitude will make you super physio who will simply be money driven. Subpar physio. Subpar physio who will be simply money driven. We are already overburdened with subpar physios. Be relevant. Yes, definitely. Yeah, questions are going to pour in and this live will be endless. So I
Yes.
think we should wrap up the live session, and I had so much fun interacting with the students and giving my insights. And I think you also
Very
learned a
glad.
few things.
Yeah, I learned a lot as a soon I'm gonna be intern in a year, I guess so. Yeah. So, and I'm even glad that Ashish sir was in our life and he has given his insights and he has added few points. I'm very glad. Thank you so much, sir, and hope to see you in our many lives in future. Not
Yes,
only just Pallavi ma'am's life, even in our life. So yeah.
definitely.
I hope you guys have learned a lot,
Hmm.
and I hope that it helps you, like in future, or if you are intern right now. So let's over here end this live. So thank you so much, sir. Bye, sir.
Bye. Take care.
I'm gonna save this live very
Yeah.
carefully. Yes. Bye, bye. Take care. Good night.
Good night.